First Generation Antipsychotics by Haley, Nakaya, Tyler, Suha, Alexis, Stella, Leon, and Kira.
Alright, so a brief overview of antipsychotics and this chapter. So basically, antipsychotics are used to treat psychotic disorders such as schizophrenia and bipolar disorder. And they mainly have effects on the CNS, those effects are like emotional quieting and sedation. But this quieting enables the patient to take on other forms of therapeutic intervention and take advantage of those other forms like the nurse-patient relationship and just being able to communicate how they feel in an easier way without all of the distractions that may come from their disorder, and also milieu management and using and taking advantage of their environment and utilizing it for healing, for socializing, and for skill building. The sedation also decreases insomnia that may either come from the stress of the disorder, or it can just cure it, or not cure it, just the sedation itself. So either the stress is gone or it just might be the sedation. Either way, it helps with insomnia. But the chapter will cover pharmacodynamics, which is how the drugs, how the body reacts to the drugs, and then pharmacokinetics, which is how the drugs are absorbed and distributed and metabolized and things like that. It will also cover specific medications, their dose, the route of to take the medication, and times to take it. Also, nursing implications, so what the nurse should know about this medication and what the nurse should do whenever it's time to take this medication, or with other things happening, like maybe a toxicity of the medication, what should the nurse do? And then also patient education. What should the patient know? And how should the nurse teach that?
So the pharmacokinetics of first-generation antipsychotics. Absorption through FGAs are well absorbed when they are administered orally or parenterally, as with most drugs. Oral administration leads to less predictable absorption than parenteral administration. In general, intramuscular preparations reach their peak concentration sooner than oral drugs, and as a result, they have earlier onset for action. So the half-life. So antipsychotics usually reach steady state in about 3 to 5 hours, and is metabolized in the liver via the cytochrome P450.
First-generation antipsychotics function by blocking dopamine receptors in the brain, particularly the mesolimbic pathway, leading to emotional quieting. This dopamine blockage also induces sedation, which can be beneficial in treating insomnia. While these medications are highly effective, they are associated with a higher risk of side effects compared to the newer antipsychotic generations. These side effects arise due to the drug's mechanism of action, which, in addition to dopamine blockage, also inhibits histamine and muscarinic receptors. First-generation antipsychotics are primarily used to treat mental health conditions such as psychosis, schizophrenia, anxiety, depression, or acute mania and bipolar disorder. And due to their dopamine-blocking properties, they're also prescribed for nausea and vomiting. The intended therapeutic effects of this drug class include reducing positive symptoms of schizophrenia, which may also occur in other psychiatric conditions. Some of these symptoms may include agitation, hallucinations, delusions, bizarre behavior, or insomnia. When used for nausea and vomiting, the expected outcome is a decrease in both symptoms.
Okay, so now we're going to be talking about the specific medications for first-gen antipsychotics. We have 3 separate medications, and they're divided by being a high-potency drug, moderate-potency drug, or low-potency drug. So for the high-potency drug, it's haloperidol, moderate potency is perfenazine, and low potency is chlorpromazine. Every single one of these drugs has a usual dosage. It also has the rate of EPSEs. These would be those movement disorders, just would be something that the nurse would just need to keep an eye on, as well as the rate of anticholinergic effects. This would be things such as dry mouth, tachycardia, constipation, and then the rate of orthostasis, which is just lowered blood pressure. And then we also have the rate of sedation and the rate of weight gain. So for the high-potency drug, haloperidol, the usual dosage is 1 to 15 milligrams a day. The rate of EPSEs is high. The rate of anticholinergic effects is low. The rate of orthostasis is low. The rate of sedation is low. And the rate of weight gain is low as well. And then our moderate potency drug is perfenazine. The usual dosage is 12 to 64 milligrams a day. The rate of EPSEs is high. The rate of anticholinergic effects is low. The rate of orthostasis is low. The rate of sedation is low. And the rate of weight gain is low. And then our low potency drug is chlorpromazine. The usual dosage is 200 to 100 milligrams a day. The rate of EPSEs is moderate. The rate of anticholinergic effects is moderate. The rate of orthostasis is high. The rate of sedation is moderate. And the rate of weight gain is high.
I'll be discussing the first generation antipsychotics, common dosage, times, and routes. The first medication I'll be discussing is chlorpromazine. This was actually one of the first antipsychotics developed. You could take this oral and intramuscular. If you take it oral, you probably take around 100 to 200 milligrams per day. And this can be broken up into multiple doses. And then if you take it IM, this is 50 to 100 milligrams per dose. And this is usually administered 2 to 3 times a day if needed as well. And then we have pyrimethamine. You could take it oral and you could take it intramuscular. If you take it oral, your dose is probably between 12.5 to 64 milligrams per day. And then if intramuscular is around the same. And then this can be administered 1 to 2 times daily as needed. And then we have haloperidol, which this can be, the doses can range from 1 to 15 milligrams. And this is usually one that's administered intramuscularly every 2 to 4 weeks. So this is not usually a everyday drug.
Okay, we've had some technical difficulties, so I can't play Leon's audio, so I'm just going to read his slide for him. So we have the first-gen antipsychotics. These are the common side effects. We have that these drugs are effective, but they have a higher risk for adverse effects. First-gen antipsychotics typically have several types of side effects. Anticholinergic effects would be constipation, urinary retention, dilated pupils, dry mouth, no sweating. Adrenergic effects would be a decrease in blood pressure. The EPSEs, which are the extrapyramidal side effects, would be akathisia, which is restlessness, akinesia, which is slow motion, dystonia, which is abnormal postures for muscle spasm. Then we have low potency. This would produce anticholinergic and anti-adrenergic effects. Sedation and significant weight gain are also produced. Then we have moderate potency, which can produce anticholinergic effects. And then the high potency would cause fewer anticholinergic side effects but produces more serious extrapyramidal side effects.
When caring for patients on first-generation antipsychotics, it is important to monitor for side effects. Extrapyramidal symptoms like tremors and rigidity should be assessed regularly as they can impact movement. Patients should also be educated about sedation and drowsiness, which increases fall risk. Another concern is tardive dyskinesia, which can cause involuntary facial movements, so early detection is key. Regular vital sign checks are important since these medications can affect blood pressure and heart rate. And lastly, adherence can be a challenge due to side effects, so ongoing patient education and monitoring are essential for safe and effective treatment.
As nurses, we play an important role in monitoring and managing effects of antipsychotics, but educating patients is just as important. Patients should have regular blood tests, liver function tests, glucose and lipid checks, and EKGs to monitor for side effects and ensure safe medication use. Antipsychotics already cause drowsiness, and adding alcohol or sedatives increases sedation and breathing problems. Patients should avoid alcohol and other CNS depressants to prevent excessive drowsiness, dizziness, and respiratory depression. They should inform the provider about all medications, including over-the-counter drugs and supplements, to avoid harmful interactions. Hot water lowers blood pressure, which can cause dizziness and increases the risk of falls. Patients should take lukewarm showers instead of hot ones, stand up slowly after bathing to prevent sudden dizziness, use non-slip mats in the bathroom to reduce the risk of falls. This is especially important for older adults or those prone to dizziness. Antipsychotics make the skin more sensitive to sunlight, increasing the risk of severe sunburns. Patients should wear sunscreen when going outside, wear a hat and sunglasses, avoid tanning beds, and prolonged exposure to prevent burns and skin damage. Stopping FGAs suddenly can cause extrapyramidal symptoms like tremors, muscle stiffness, restlessness. To prevent withdrawal effects, patients should never stop medication suddenly without consulting the doctor. Follow a gradual tapering plan under medical supervision. This ensures a safe and comfortable transition if a medication change is needed. Patients taking FGAs should stay informed, follow safety precautions, and maintain regular checkups to ensure their treatment remains effective and safe.
Here's our multiple choice question number 1. Here's the answer and the rationale. Question number 2, answer and rationale. Question number 3, answer and rationale. And then our references. Thank you.